The unraveling of a multi-million-dollar healthcare fraud scheme. In 2017, the owner of a small medical billing company in California received an unexpected visit from federal agents. The agents informed him that his company was under investigation for healthcare fraud. At first, the owner was confused and denied any wrongdoing. However, as the investigation continued, it became clear that his company was at the center of a massive healthcare fraud scheme. The scheme involved a network of corrupt medical professionals, billing companies, and pharmacies. The participants would submit false claims to Medicare and Medicaid for unnecessary medical procedures, prescriptions, and equipment. The investigation revealed that the medical billing company was responsible for submitting millions of dollars in false claims. The company's owner had been recruited by a group of corrupt medical professionals who promised him a share of the profits. As the investigation continued, federal agents uncovered a complex web of deceit and corruption. They discovered that the participants in the scheme had created fake medical records, prescriptions, and billing documents to support their false claims. One of the key players in the scheme was a corrupt doctor who had recruited several other medical professionals to participate. The doctor would perform unnecessary medical procedures and prescribe unnecessary medications, which would then be billed to Medicare and Medicaid. The investigation also revealed that several pharmacies were involved in the scheme. The pharmacies would fill prescriptions for unnecessary medications and then bill Medicare and Medicaid for the prescriptions. As the investigation neared its conclusion, federal agents arrested several individuals, including the owner of the medical billing company, the corrupt doctor, and several pharmacy owners. The defendants were charged with multiple counts of healthcare fraud, conspiracy, and money laundering. The investigation had uncovered a scheme that had defrauded Medicare and Medicaid of millions of dollars. The trial was highly publicized, and the defendants were found guilty on all counts. The corrupt doctor was sentenced to 10 years in prison, while the owner of the medical billing company received a 5-year sentence. The pharmacy owners received sentences ranging from 2 to 5 years. The case highlighted the need for increased vigilance in detecting and preventing healthcare fraud. It also demonstrated the importance of cooperation between law enforcement agencies and healthcare organizations in combating fraud. In the aftermath of the trial, several healthcare organizations implemented new measures to prevent healthcare fraud. These measures included increased auditing and monitoring of claims, as well as improved training for medical professionals and billing staff. The case also led to changes in state and federal laws related to healthcare fraud. Lawmakers introduced new legislation aimed at increasing penalties for healthcare fraud and improving enforcement mechanisms. The story serves as a reminder that healthcare fraud is a serious crime that can have devastating consequences for individuals, families, and communities. It also highlights the importance of vigilance and cooperation in detecting and preventing healthcare fraud. As the healthcare industry continues to evolve, it is essential that we remain vigilant in our efforts to prevent healthcare fraud. We must continue to work together to identify and prevent fraudulent activities and to ensure that those who commit healthcare fraud are held accountable. The case of the multi-million-dollar healthcare fraud scheme serves as a reminder that healthcare fraud can have serious consequences, but it also highlights the importance of cooperation and vigilance in detecting and preventing fraudulent activities.